This is phase 2 of the thoracic spine. First exercise is T20, the shrug and roll back with the TheraBand. Have the patient step one foot, then the other foot. He's got the TheraBand wrapped around his hands where it's comfortable, good resistance. Patient's looking straight ahead, the chin's not forward or back. He's shrugging straight up, and then he's rolling back, squeezing between the shoulder blades, and then back down. I'll show another angle, up and back. That is T20, the shrug and roll back. Next, we have the seated row with the TheraBand. In the office, you just have them wrap around whatever they can find. You can wrap it again around the wrist. Good posture, he's sitting up straight. He's rolling the shoulders back and squeezing in between the shoulder blades. His neck isn't forward, it's not back. Good posture. Squeeze for a second or so. If you notice the shoulders come back first, and then he squeezes. Next we have the upright row. So again, we'll have 1 foot and then 2 feet. He's going to wrap them. He's going to put his thumbs together. Elbows come up first, the band slides up his chest. Just hold for a second or so at the top, it's fine. His neck's not coming forward, he's not leaning back. His hands are together, they're not rocking one way or the other. And that is the upright row T22. Next, we have the T23, which is quadruped, opposite arm, opposite leg. This is done on the table here. Feet are together, knees are where they are, nice spaced out. Patient's going to lift one arm and then the opposite leg. Legs straight, arms straight. He's holding them. He's going to hold for about 3 seconds, and you can advance to 5 seconds, or even to, I'd say 10 would be the max. And the patient's going to feel their core kind of tighten up a little bit. It's going to challenge them some. And even to make this harder, you would just use 1 to 2 fingers and just kind of advance from there. Next we have T24, which are the pull-aparts with the TheraBand. The directions we're going to do is horizontal abduction, and then we're going to do some diagonals, which we call the X. So again, he's got his hands together, he's squeezing back, he's pinching in between the shoulder blades. Good second or two squeeze. Nice controlled breathing through all these exercises. Then we'll demonstrate the X. Just kind of pulling it apart, a diagonal angle. Again, posture is key. Really squeezing between the shoulder blades there. And that's the pull aparts. Next we have Brugger's. This will be with eyes open. So this one, first we'll have them kind of retract their neck back. Then thumbs, we'll have the thumbs rotate out, really squeezing between the shoulder blades and kind of pulling them down a little bit. Hold that position for 15 seconds. And we'll start at 4 reps and kind of work our way from there. Breathing is key. Should feel a stretch through the pecs a little bit and some squeeze in between the shoulder blades. And that's the Brugger's. Next we have the prone scap squeeze. We have the patient lie on their stomach. Arms are to their side. First, he's going to shrug his shoulders up, and then he's going to drop them back, and then kind of pull up the arms a little bit. This is all nice and slow movements. Really squeeze in between those scapula right there. And notice the arms do come off the table at the end. And he's going to hold that for about 2 to 3 seconds there. And just make sure the positioning is in the proper form is correct. Next we have T27, which is quadruped T-spine rotation. So again, you'll use the table, have them in quadruped here. One hand's behind the head. You're just going to rotate just about a second or so. This one can be difficult. Just nice controlled breathing. They're not holding their breath. You're probably doing about 5 on each side and kind of increase from there. And then the last one, which is T28, is the alternating seated row. So this one is again done seated. You can do these standing if there's not enough seated room in your facility. Good posture is key. Just like the seated row, we're going to do these one at a time, so we're focused on the muscles on each side individually. He's really squeezing this one of these shoulder blades. There's no trunk rotation when he's pulling the bands. Show a bad form there. So bad form, you would see him kind of rotate at the trunk. So this one's all done by those muscles right in the mid-back region, all the thoracic spine area. All right, and that is phase 2 of the thoracic spine.